Don't record yet. Don't record yet.
Don't
Just stop the-
Welcome, everybody. Oh, there we go. Okay, I was about to tell you that it was coming, but here's the QR code for our pre and post survey. Welcome to the Substance Use Roundtable, sponsored by JOWMA, MASC, Amudim, and CCSA. We're so happy that you're here. We'd be very, very grateful if you would scan the QR code on the screen right now, which will take you to a pre and post survey, which would provide very, very helpful information for us in developing our programming. And it will automatically enter you into a raffle for an $100 Amazon gift card. The link to the survey is also in the chat. We're going to be starting shortly. Thank you, everybody, for coming. Again, welcome to the Substance Use Roundtable. We're going to be starting shortly. While you're waiting, please scan the QR code that's on your screen. It will take you to a pre-survey, which will give us really valuable information in developing our programming. We'd be very grateful if you'd fill it out. And it will also enter you into a chance to win an $100 Amazon gift card. The link to the survey actually now has just been put into the chat. Thank you. Please fill it out for a chance to win $100. We will be starting shortly. Oh, so yes, there's going to be a post survey as well, which we're going to put up at the end, which we would also be very grateful if you could fill out for us. Please scan the QR code for a chance to win an $100 Amazon gift card. Okay, so it's 8:05, so I think we're going to get started. Welcome, everybody. We're so happy that you're here at our Substance Use Roundtable. We are about to get started, so just a few points of procedure. There will be, if you have any questions, please feel free to enter them into the Q&A box, and you can enter them at any point during the discussion or at the end, and we will answer questions along the way or at the end. I want to thank all of our sponsors and our co-hosts so much for working with us today, including MASC, Amudim, and CCSA. We're so grateful to have all of you working with us in JOWMA on this incredibly important topic. So I'm going to introduce our three panelists today, but before we get started, also just one short point at the end, we're going to be joined by Dr. Debbie Ackerman, who represents MASC, who will who will tell us, give us a few words about her amazing organization and the resources that it has to offer our audience. So please, at the end, please stay tuned for Dr. Ackerman. Okay, so now I'm going to tell you about our excellent panelists. So first we have Dr. Jeffery Berman, who is an addiction psychiatrist. He specializes in the treatment of young adults suffering from substance use and co-occurring mental health disorders. Dr. Berman serves as Director of Psychiatric Services for SOBA, New Jersey, and is Senior Addiction Psychiatry Consultant to Avenues Recovery, as well as Senior Psychiatric Consultant for ACE Health Service Corps in the U.S. Department of Homeland Security. He's a member of the Department of Psychiatry at Rutgers Robert Wood Johnson Medical School, and it was co-director of the Addiction Psychiatry Fellowship. He's initiated and facilitated a support group at the JCC in Tenafly called Strength to Strength, serving parents of young adults who have substance use and mental health disorders. He's a national speaker and has served as president of the New Jersey Society of Addiction Medicine. Welcome, Dr. Berman.
Thank you.
Our second speaker, Lianne Forman, is a corporate and employment lawyer by training, and she's the executive director of Communities Confronting Substance Use and Addiction, or CCSA. This is the organization that she and her husband Etiel founded in 2018. Through their own family struggles, they founded CCSA to create greater community awareness and education about substance misuse and addiction in the Jewish community. CCSA's mission is to eliminate stigma around addiction in Jewish communities through awareness events, facilitating evidence-based educational programming in school for students, and providing support to families and communities. Welcome, Lianne Forman. Okay, our third illustrious panelist is Rabbi Gluck, who is the CEO of Amudim, who spends his days and nights heading Amudim's operations, channeling his energies and inborn skills to ensure its seamless function. He is a Queens Hatzalah member who also serves as chaplain for the Port Authority of New York and New Jersey Police Department, and is an NYPD clergy liaison. Rabbi Gluck was ordained as a rabbi in 1999 by Rabbi Moshe Faskowitz of Yeshiva Madregas Ha'adam. He lives with his wife and children in Kew Garden Hills. Welcome, Rabbi Gluck. And I realized I forgot to introduce myself. I'm Dr. Tal Weinberger. I am an adult psychiatrist and director of outpatient services for the psychiatry department at Thomas Jefferson University. So welcome all of our panelists. Okay. So we're going to get started with the first question, which is surrounding the use of terms when we're having a discussion about these topics. So I hear the term substance, quote unquote, abuse, and the word abuse, I think, is a really significant one here and worthy of discussion itself. Also, other terms that are used include addiction, dependence. Are they all the same thing? Can you explain what addiction is? Why don't we start with Ms. Forman?
Thank you so much. Thank you for having me. So it's interesting. When we formed our not-for-profit, we started out as Communities Confronting Substance Abuse, CCSA. And along our journey, we were told by people in recovery, including my daughter, that the word abuse connotes a purposeful, immoral action, that you're basically linking linguistically a mental health disease, which should be morally neutral. There's no such thing as a moral failing or a character flaw when you're struggling with a mental health issue like addiction, and you're linking it to the use of substances or the misuse of substances. So to get rid of that negative inference, to really combat the stigma that is associated, unfortunately, with addiction and substance use, we actually legally changed our name over a year ago. We kept our CCSA, but we have a little bit of a longer name to still fit that acronym. But the bottom line is that the word abuse is something that is commonly used, but probably, especially for people who are in recovery and who are sensitive to it, should not be the norm. The norm should really be, either misuse or substance use or disorders. But I will let the experts speak to the difference between dependence and addiction.
So I'll jump in, Lianne, and say the following. The nomenclature, the use of terminology has evolved, just as you mentioned, over the past few years. In the psychiatric and the medical communities, we use the terms substance use disorders, as you pointed out, and it does convey the fact that there is something not possibly not desirable about using substances, but it allows us to communicate very precisely about what we are talking about. And it lets one clinician talk to the other and say, a substance use disorder, mild, moderate, or severe. The old terminology was abuse and dependence. And be careful when, we have to be careful when we use the term dependence. Dependence can mean physiologically dependent, and anybody can become dependent on a substance. It doesn't mean that they have the disease of a substance use disorder. It means just physiologically, physically, they can become dependent on something. What we're talking about tonight are the other behaviors that go around substance use, and it's what we would call the addictive behaviors. And those are the problematic behaviors associated with substance use. So it's best not to get hung up on terms, except insofar as when we do talk to other people, we don't want to delegitimize who they are or where they come from, particularly when we're dealing with young people.
I don't really feel that there's anything I can add to that. Between the two of them, you got a 100% perfect explanation.
No, thank you. Dr. Berman, I was hoping you could clarify a little bit more for the audience about what dependence means.
So when we're talking about dependence and we're talking about substance use disorders, we're talking, so this will broadly, I guess, is a good introduction to what we're really talking about tonight. We're talking about a set of, it's talking about a disorder. There are many disorders and we characterize them by the substance involved. We talk about alcohol use disorder, opioid use disorder. Tonight, I think in particular, cannabis use disorder, the use of marijuana and related compounds. But when we're speaking about the disorder, we're talking about the behaviors such as using a substance in a greater quantity than someone starts out to use it in the beginning. In other words, everyone might say, I'm going to have a drink. We'll go over to alcohol. But someone who has the use disorder cannot limit themselves, for example, just to one drink. It's using a substance knowing that it's causing problems with your health, with your family, with your occupation, with your life in general, but continuing to go ahead and use the substance. And it's using a substance to which you have become physiologically dependent, or when you stop using the substance, you have a typical what we call withdrawal pattern. And it's a combination of those items. And it's usually depends on how many of the criteria you fit, whether it's mild, moderate, or severe. But it's these behaviors per se that define what a substance use disorder is.
Great. Thank you so much. Yeah, no, so I think, again, to just reiterate, physiological dependence just means that when the substance is withdrawn, your body misses it and demonstrates that in some, in some sort of way that, doesn't necessarily have anything to do with, with addiction or misuse. Please, everybody, put questions in the Q&A box by clicking in the bottom of your screen. We'd love to hear your questions. Okay, so pivoting a bit to talking about substance use in the Orthodox community, how common is it? And what about in teens in the Orthodox community?
Are you addressing this to anyone specific? What's the
Rabbi Gluck, why don't you take this one?
Okay. First of all, thank you for having all of us here, and hopefully we'll bring about positive change. It is actually a lot more common than people want to believe. A lot of it, and I know I'll see some of the questions later on, but there's going to be a lot of overlap, so I'm prepared for that. But a lot of it is, a lot of various different addictions or addictive behaviors come as a result of certain misinformation, we'll call it, regarding certain customs, but it's still something that's there. But regarding substance abuse itself, I mean, there's, multiple different substances. I can tell you alcohol is very, very high, even starting at much younger ages. Marijuana, which, is becoming a problem in and of based on the fact that is getting legalized in more and more parts around the country, is also being, used very, very frequently. And we noticed a huge uptick on pills. about 2.5 years ago till about 1.5 years ago, we started noticing a little bit of a downtick. And then the last year and a half, the number started coming up, once again. But the main, issue that we see is not necessarily the amount of use, but it's the lack of proper education, the lack of understanding, the lack of people being willing to get the appropriate help, even once it does come out, whether it's because of the stigma or because they're fearful that they'll be thrown out of school or community ramifications. So at the end of the day, we're not immune from any of these issues compared to any other community. The only difference is our response as the Jewish community should be a lot greater and a lot better. And unfortunately, I believe that we're lacking there tremendously.
Yeah, I'm going to actually jump in on the prevention side. So one of our flagship programs is a prevention education program. We go into middle and high schools. We speak to students. We've been in over 44 schools. At this point, we've educated almost 8,000 children, our Jewish children. And we do something interesting, which is we ask them to submit anonymous questions. And we now have thousands and thousands of these questions. And many of these questions are admissions of use. And we start as early as 6th grade. And these kids are asking questions about substances they are using, not, in the third person, not, curiosity, although we have those also. I agree with everything Rabbi Gluck said about misinformation. There's a lot of questions that come from misinformation. And I think, what's really important to understand, and it's true that we are not immune from this. There's very little data out there. There was one study done in 2019 and again in 2020 measuring use amongst other issues amongst 10th and 12th graders. And it's compared to a national study called the Monitoring the Future study, which has been around for, I think, about 75 years now. And where we ended up in those 2 years measured over 20 schools in various parts of the country, we ended up in past 30-day use of alcohol and binge drinking higher than national averages. And in terms of marijuana use, nicotine, and other substances, not that much lower, maybe a little bit lower, but not to the point where you could say, oh, great, our Jewish children are protected from this. I mean, exposure is happening everywhere, whether it's at a kiddush, whether it's seeing adults or other, people in your life using substances, the legalization of marijuana, the opioid epidemic. Exposure, we talk about exposure, and I always say this to parents, exposure is not some drug dealer handing your kid drugs on the street corner. Exposure is seeing it, hearing it, advertisements, social media, and we have to be realistic. Our kids are sponges and they absorb all of this. And unfortunately, that's why we have to do what we're doing, which is to talk to them, educate them, and make sure that they're making healthy decisions.
I'm going to jump in for a second just to respond to that. One of the concerns that we have regarding a lot of the studies is, first of all, many of the mainstream schools in our community do not allow studies to truly be done in the proper way. So that's one issue. Obviously, they also don't allow for the education and prevention programs to be done as well, as important as they are, but they're very limited in who's allowing programs in or not. And we do know that when we were helping with the study back in 2020, 2021, some of the schools basically made sure that not everyone that were involved in it, we found that they were trying to ensure that their numbers would come out, not that bad, which didn't really help them, because even the ones that we did do still showed what they were. But the reality is, and this is something that I say to everyone that's watching this, is that this is really in the power of the parent body. Schools very much want to keep themselves on a certain level, and I understand that. They want to be able to get tuition, fill their student body. But if as parents, we can stand up and tell the schools, we want the schools to have more of these things, the schools will have to do it. If they're concerned about the parent body, we need the parent body to step up. Just like Lianne said, Amudim also has we don't have a specific addiction program, but we do have a social emotional learning curriculum, and we've had to modify that multiple times. And in order to be able to be acceptable to many schools, and we are still trying the best. But when we're talking about the younger ages, and you mentioned teens, again, if they don't know what to be careful from because there is a lack of prevention and education, then they don't know what dangers lure ahead of them.
Thank you. That's fascinating. And, I'm wondering what your thoughts are about to what extent, that sort of lack of, of education in the schools might be, contributing to the fact that, to whatever extent our numbers are higher in some areas, or what other factors you might contribute to attribute those higher numbers to.
I'd like to add, I'd like to add also is that if we don't provide good, targeted and appropriate education, like you said, it was mentioned, kids are sponges and they will pick everything up from, we live in a very open media centered kind of society. And, the kids are reading marijuana is legal now. And our kids would probably come to the same conclusion as other kids do. Well, if it's legal, what's wrong with me using it? And now in particular, we're facing a period of time where something that many parents have been blowing off as being significant. I mean, the use of marijuana, many parents will say, well, at least he's not doing pills or heroin or something else. The point is that the marijuana that's being sold today, even that's being sold out of dispensaries, is very potent. And I, as a treating physician, I'm seeing an uptick in the number of kids who are coming in with what we call psychosis. They're coming in with hallucinations, with delusional thinking, not because they're doing, LSD or hallucinogens, but they're actually getting it from the marijuana that they're using. So I think we have to educate properly. Otherwise, the education is going to come from other sources, which we have no control over.
Thank you.
To get to your numbers question, it's really a double-edged sword. It's very hard to get real statistics of something that we don't have access to real data. So, I mean, just give you like a simple example. I was speaking at a principals conference and I made a statement that was in the Midwest, and I made a statement that I don't know any high school that could safely say they have no drugs in it unless either there's no students or no school. And a certain principal from a very prominent school got up and said, what are you talking about? In our high school, there's no drugs. And I'm sorry to say this, I couldn't control myself. I started literally laughing and like right in front of everyone. I couldn't control myself. And then the person got upset at me, like, you embarrassed my school by you doing that. People know there's drugs. Well, who told you to say such a silly comment? The problem is that very often, and people don't realize this, depending on the types of drugs, if someone has no education, and I'm not a fan of drugs in any way, I have to be careful how this comes out. But the average person who ends up getting addicted to drugs in the, in the world, marijuana, some pills, starts building up a tolerance, going into more detail, getting more and more higher dosages, etc. And that is the I guess I hate to say it, but that's like the normal pattern of an addiction being formed and created. I've seen, and we've seen, whether it's at Amudim or on Hatzalah, it doesn't really matter where, many situations in the frum community where we've responded to overdoses on a first or second time use, which is not something that I see when I'm on an EMS ambulance, responding to emergencies. I'm not saying that it's, that it's ever good. It's never good. But the concept that somebody has zero understanding of substances, of drugs, of dangers, of what it can affect, which also means they don't have the understanding of having Narcan nearby. I mean, at Amudim, we've given out close to 10,000 Narcan kits in the last few years. And we know of hundreds and hundreds of lives that were brought back from Narcan, which is the opioid, overdose reversing agent, but they don't even know about it. So here they are, not using anything, going to a party, someone saying, here, you got to try this pill. Again, let's be honest, drugs you get from a dealer, even if somebody claims, oh, I know this one, it's clean, it's not. And as Dr. Berman just said, marijuana is the same way. We're seeing marijuana being laced with fentanyl now. I mean, that's like also something that was not common. So at the end of the day, it's not even a numbers game, because if it's even one, it's one too many. But the fact that people growing up in Orthodox homes, going to Orthodox schools, don't know the differences of different types of drugs, narcotics, or things of that nature, and they will therefore use something much quicker, can lead to death much earlier, lots of other issues much earlier, and also creating an addictive pattern before someone even has a chance to turn around, because at the end of the day, when they are using something, it is fun, it is enjoyable, and they're going to want to keep using it.
Thank you so much. So I think this is a great segue into talking about like the issues around specific substances that are misused. So just, I think, start off by talking about marijuana, which Dr. Berman already gave us an awesome introduction to. I guess, Dr. Berman, if you could talk a little bit more about some of the other issues other than unmasking early onset psychosis. Some of the other issues around marijuana use that may be less widely known, and also strategies for parents and loved ones to help manage marijuana misuse.
So one of the biggest difficulties we have, or challenges in psychiatry, as you know, is differentiating between people who have for example, a psychiatric disorder, for example, depression, or people who have a psychiatric disorder such as depression, which is substance induced. And many kids are coming forward or being brought to doctors by their and therapists by their parents because they've become depressed sort of out of the blue, and no one's really sure where that's coming from, which is okay. But often what's being missed is the fact that these disorders, whether they're depression or anxiety, are being brought on through the use of substances. And when someone does finally seek treatment for a disorder, for example, anxiety, depression, someone may be wondering about bipolar disorder, doesn't matter. One of the most important things to do, and this is standard practice in psychiatry, is to make sure that whatever symptom they're presenting with or set of symptoms is not due to a underlying medical problem. For example, a thyroid disorder that isn't properly treated, and not otherwise due to a substance, to make sure that the kids that are being treated are not using substances which are causing the symptoms. And I'll mention it now, there's a big reluctance on the part of people who are treating kids in the frum community, in the Jewish community at large, and in many communities, to go ahead and even take the step and say, hey, could this be a substance? Are you using substances? Many doctors are afraid to ask the question, and that question has to be asked by doctors and by therapists. So that's where there's an overlap between other mental health issues and substance use. And just to mention one other thing, the biggest problem, Rabbi Gluck was speaking a moment ago about pills. And pills is part of the progression of, substance use. And there was a time when pills that were taken, say at a party, or kids passing pills one to the other, they knew what they were passing from one to the other because they came out of a bottle that came from a pharmacy. Now, with the fentanyl epidemic, fentanyl is being added to what we call pressed pills. There are pills that are being made to look like the real thing, but they're really only fentanyl. So they're adding it to marijuana, and they're also making bogus or fake pills. And kids have been dying on the first use, and that happens to be true. It just happened to 2 medical students in Ohio who thought they were taking 2 Adderall tablets to help them stay up all night, and unfortunately, they took an overdose of fentanyl. So these are the kinds of things that we have to be concerned about. And again, Rabbi Gluck mentioned it on 3 occasions, and so did Lianne. Alcohol should never be pushed aside as something that's, well, it's okay, it's legal. We use it in some of our religious practices, but that is probably the most widely used substance out there.
I'm going to jump in and say to what you said. As a paramedic, if somebody's having a possible heart attack, we're not embarrassed to ask them if they're taking Viagra, because if they are, and we give them other medications, we will actually cause their blood pressure to drop and have them, possibly die. But we have seen that when we are showing up on scenes where it's seemingly an overdose, or someone might be, catatonic, not really knowing what's going on, and they will be in denial over it, not realizing that this is a question of life and death. By the way, that goes back to what I was talking about of the educational side. Because if people don't realize that can create the damages, that's the problem. But I want to just touch on one other thing Dr. Berman just said. You said alcohol is legal. We can't forget about that. I say the same thing about marijuana when I speak regularly. And I started saying this a couple of years ago. Actually, Lianne and I were doing an event a couple of years ago. And when marijuana was first, I think it was only legal then in a couple of states, and 4 or 5 states at that point. And we had both said on the panel, it's only a matter of time before everybody, it's going to be legal in every state, but that doesn't mean that it's appropriate. So when you asked about kids, I'm not going to speak about the clinical component, I leave that to Dr. Berman, who's doing a great job. But first of all, car accident rates, very, very clear as they have gone up between 6 and 10% above what they were in areas that have legalized marijuana versus those that have not. Yes, drunk driving is still higher than it, but it is starting to close that gap, which is a very scary thought. Fatal car crashes are up by 6% for marijuana-related injuries. And these were compared based on states that have legalized marijuana versus those that have not. There's also the other big component, which is the brain development. The human brain does not fully develop, and there's a disagreement whether it's 23, 24, 25, or 26, but it's either way definitely above 18 and definitely till 21 at the very least. So, people, you used to see those ads on TV, this is your brain on drugs. All I wanted to do is make myself eggs and have, an omelet. But the reality is it does fry the brain, and people don't understand that. Again, lack of education. When we used to speak in schools, people would be like, oh, but it's becoming legal. I would say, you know what? My grandmother is able to take something. Why can't I? So I would say, listen, go take your grandmother's heart medication, her blood pressure medication, everything else that she's taking for diabetes. I mean, if you're trying to just use your grandmother's meds, why are you choosing marijuana? Because you managed to get your grandmother with glaucoma to get a prescription so you can have it legally before it was legal recreationally. At the same time, we are noticing that, there's this famous debate, gateway, not gateway. I always tell people there's people that are using drugs to run to and people that are using it to run from. That's a whole separate debate, separate discussion, which we can go into at length. But the fact remains, it's not good. And, this concept of parents saying, well, I'm happy that my son or daughter is using, weed because they're not taking pills is something which is a little bit scary, because that means we have, as a culture, accepted that that's there, and that's what we're just basically going, which we cannot allow that to happen. And I say the same thing about alcohol. Everyone's busy talking about, yeah, but you have to do it. The case is this. There's nothing wrong with grape juice. I have no problem drinking it. Others can do as well. But at the same time, when we start to create that little opening of saying this is okay and it's better this than that, what's going to be next? And that's really my fear when parents go through that angle of saying it's okay.
Yeah, and I just wanted to jump in one. Sorry, I just want to jump in 1 second. We have 8 or 9 presenters in recovery that deliver our educational programming. Everyone I've met, including my presenters, have started their substance use between the ages of 11 and 14. Every addict I've ever met has started with alcohol or marijuana or both. Nobody jumps right to cocaine or, meth or heroin. There's a progression for those people who are susceptible to addiction, and it is a biological brain disorder. So those who are susceptible, there's a starting point. So, Rabbi Gluck, when you talk about a gateway drug, we have to think about that where does addiction start? It starts from that early use. I know with my daughter, her first drink was just before she started high school. It was a progression. She did not wake up one morning and say, I'm addicted. It took until college. But there was kind of a moment where using alcohol relieved her anxieties, relieved her fears about starting high school, very normal emotions, using an unhealthy coping mechanism to deal with them. And that's a very similar story for every single person I've met in addiction. The other thing I wanted to say is that, with the legalization of marijuana has become the new alcohol. It is, the perception of harm is so low, the availability is so high, no pun intended. We have 20s and 30-year-olds using it at kidduses because, downing a shot of scotch is not so cool. It's really for the older folks, but, eating an edible on Shabbos, that's great. And kids are getting into those edibles, and there are lookalike products. And the last point I'm going to make, and then I'll let you move on to the next question. When we talk about dealers, we all have this image. I know, before I entered the world of addiction, I had an image. An addict is some derelict bum under a bridge with a needle hanging out their arm, some homeless person. When you talk about a dealer, you're probably picturing somebody on street corners, peddling drugs. And if you walk into Times Square, you will come across dealers everywhere. My husband just got offered cocaine on the corner of Times Square. But dealers are also people in our community. They're people wearing yarmulkes, they're people going to shul, they're people who look like you and me. So we have to be careful when we use that word. It sounds very othering. I know in my experience talking to kids, they will say to me, my friend is dating a dealer who goes to such and such school, which is a named yeshiva in our community. So when I say dealer, you know, and I think when Rabbi Gluck says dealer and Dr. Berman, we're not talking about people like on street corners. Yes, those people also could be giving us tainted substances, but we have to be careful even from within. I don't care if it's your brother's cousin who claims he got it from someone he trusts. You know, we're still running the risk of tainted substances, and it is being laced into things. And I know I've met people who didn't think they used fentanyl and then went into rehab and had their blood work done and came up positive for fentanyl.
So let me just add one thing to that before you jump off, which is I was on a Hatzalah call a few months ago on a Shabbos morning when we had twin 7-year-olds that were extremely lethargic and were not breathing very well. And it turned out that and the reason why they held off calling us was they were scared. What it was they got into the fridge, took out brownies that were made with marijuana and finished the entire pan. That was one. And another component, which we all have to know, because listen, people that are adults are coming home using weed, you know, in front of their kids, the kids know about it, where we had a situation where an 8-year-old was eating by a friend for a Friday night dinner, and the mother brought in brownies for dessert, and she says to this mother innocently, are those the brownies I'm allowed to eat or not allowed to eat? And when that comes out that an 8-year-old is asking that, I mean, on one hand, okay, it's nice that the kid's asking and not by accident too many, but the mere fact that that's even the question that an 8-year-old is asking makes us all ask ourselves, what are we doing wrong?
So I just want to ask one more question about marijuana before we move on from the chat, which was a question about like milder versus more serious marijuana. Is there such a thing? Is there marijuana that's safer versus marijuana that's not safe? And, you know, is there kind of room for compromise?
I would say that the analogy to use is that of alcohol. You can start out with alcohol that might be 5% alcohol. And depending on what choice of drink you're consuming, you know, you can go up to, 50% or more proof. The marijuana per se, all in and of itself, can be stronger, and it can have more what we call psychoactive or psychotropic effects and cause more, lead to more psychiatric illness, both short term while they're using it, but also in terms of having and Svi said the issue about your brain on drugs and getting fried, but over the course of time, it can do more and more damage. And I would just give this example as having done provided mental health services, for example, at Rutgers. I would say that the hardest substance for me to help get a student off of has been marijuana, because they see it as something totally benign. They don't see the additive effects that it's been having on their lives, decreased academic performance, abnormalities in their eating behavior, abnormalities in their social behavior. So as the drug becomes more potent, so do the effects, and also the chronicity of use. How long you've been using it for also has an effect. And then finally, we used to be concerned about marijuana that was what we call dipped marijuana, and it could be dipped into different solutions like embalming fluid, formaldehyde. But now the concern isn't so much that, it's the fact that it's being laced with fentanyl. And that's to make it more potent. And it's also to maybe make it more addictive so that people keep coming back and using it. And that's an association people don't make automatically, but they realize I need this to feel better. So again, we have to educate the kids that this is not a benign substance. And most of all, you do not have any idea what it is that you're consuming when you smoke marijuana. You really don't.
So I think we'll take a break from marijuana for a minute, even though there are still some really great questions out there about marijuana, but I don't want to spend our whole time on that. Let's just segue to alcohol for a minute, and alcohol specifically in the Orthodox community. So as we've all spoken about, alcohol is really pervasive in our community on Purim, Shabbos, Simchas Torah, et cetera. So how are we supposed to kind of, thread that needle? How can we prevent our teenagers from making bad choices when it's all over the place? And then I think integrating a question from the chat is the right choice to just kind of ban it from our homes. Ms. Forman, why don't you take this?
I think it's a very personal decision. I mean, we have wine in our home, do I drink it around my daughter? No, that's a personal decision I've made, that while she's in recovery and she actually works in a restaurant, isn't exposed to alcohol all the time and is definitely of legal age and, can go out with her friends. I've made a personal decision that that's not something I'm comfortable doing, but I think in shul settings, I don't think there should be alcohol. I think that, in a public setting, it happens too many times. People push alcohol and people, come on, let's have l'chaim, come on, just one. A person says no, they get pushed again. You have no idea if that person's in recovery from an alcohol use disorder. You have no idea what their struggles are, whether they've been, sober for a week or sober for 20 years. And I think in that kind of setting, the wine tastings and the whiskey tastings and all these things, it sends a message that we culturally approve of the use of this. Now, already it's so intrinsic in everything we do. Purim, Pesach, Simchas Torah, Shabbos, Kiddush. I mean, everything we do, all our rites, our rituals, our chagim are all around alcohol. We're already sending that message. I do think that in many ways, marijuana, and I know you said you're moving off of that, but I think there is messaging around that. It could very easily, like Rabbi Gluck said, you could have Rabbi stand up at the pulpit and say, we're not doing this, even if it's legal and the rest of the world is doing this. We're not like that. We hold ourselves to a standard, and this is not something, compromising your judgment and your reaction time and your ability to, function is not pretty. It's not a good look. So I think that there is something to be said about having shuls ban it. I think in a home, you have to make a personal decision. I'm not so sure that you need to say to your kids, oh, I want you to drink here and not drink elsewhere. I know there are parents who say that, like, come on, you'll try it here with me where it's safe. I think you can be very clear and say, you know what? Like Rabbi Gluck said, your brain's not fully developed. Your connections are still forming. Your frontal cortex is not done developing. If I introduce this to you, I'm not keeping you healthy. I'm not healthy. I'm not keeping you safe necessarily. And I'm giving you a message that, yes, well, I have a glass of wine. That's not necessarily appropriate for you. I think there are also very important ways to model if you are going to drink and do things in front of your children. Friday night, do you bring the whole bottle of wine to the table and plunk it down and I'm going to finish this bottle of wine no matter what? Or do you pour yourself a glass, cork it, and put it away? Bringing a bottle of scotch to the table, do you say, ooh, look at this $200 bottle of Glenlivet that's been aged for 15 years in a cask, or do you say, you know what, somebody gave this to me as a present, I'm going to take a shot, I'm going to, not even talk about it. You don't even have to talk about it. But I think the more we glorify it, we give the message unintentionally to our children. This is something that I should covet. This is something that I should want. Look how much my parents are admiring this and enjoying this and talking about it and having whole Shabbos conversations at the table about, this gorgeous bottle of scotch or this great bottle of wine. And, I can't tell you that I wasn't guilty of this too, to some extent, but I never worshiped alcohol, but certainly I enjoy it. I'm much more careful about how I enjoy it and how I message that now that I've gone through addiction in my own family.
Alcohol. So let's use that as a launch pad to talk about other steps that parents can take to kind of be mindful about thinking about preventing substance abuse in their children and ways that they can initiate conversations with their children. Ms. Forman, why don't you take it away?
Sure. So we do a parent program also in conjunction with our student programs. A lot of that is just for that reason, to encourage dialogue on both sides, to talk to parents about ways to communicate with their children. I have 5 kids. I've had 5 teenagers and 10 eyes rolling at me at various times in my life. We think that we don't have an influence on our children. We think that we, especially as they get older and they're more out in the world and they're more hanging around their peers, they're separating from us, they're differentiating from us. We still are even into their teenage years, we are still a very significant influence on our children. We do have ways of influencing them to make better decisions. I think having open and honest conversations, telling them you're looking out for their welfare, you're trying to keep them healthy and safe, being very clear about rules and expectations, having boundaries, having reasonable consequences if those boundaries are crossed. Like I said before, the statistics I quoted about my own personal journey in terms of the people that I've met and our presenters using substances between the ages of 11 and 14, according to SAMHSA, which is the federal government, the arm of government about substance use, children as young as 12 and 13 are already misusing substances, which means they started using them even younger than that. So that's a national average. And substance use is occurring, at younger and younger ages. The older a child gets, the more likely they are to be exposed to it and to try it. But, having these conversations, and it's not a one-time conversation. When my kids went into high school, each one of them, all 5 of them, I sat down and said, if something happens, if you're in a situation, you go to a party, you told me you were going over a divorce house to sleep over, and really you're at a party and you drank or you did something that you shouldn't be doing, you're with people who are doing things they shouldn't be doing, and you want to get out of that situation, you call me. I don't care if it's 2 a.m. I want you home healthy and safe. And that was it. That was my conversation about substances. And in retrospect, that was a mistake. Having conversations with your kids, ongoing organic conversations, meeting them where they're at, whatever age they're at. We have a 6th grade program, which really is just asking kids what they know about substances. What have you heard? We get questions like, can you get addicted to Tylenol and Motrin? And, which at first we kind of smiled at, and said, oh, that's so funny that they're asking that. We said, no, it's not so funny. They don't know what a drug is. They get a lot of misinformation. And so we're there to correct that, but we're really there to meet them where they're at, which I think even as a parent, you meet your child where they're at, you talk to them. The other question I always ask my kids is, do you know where to get drugs? And the answer always is no. And then the second question is, do you know who to ask if you want to get drugs? And the answer has always been yes, no matter what kind of schools my kids go to, and, whatever hashkafa you're talking about, they are always 1 degree removed or 2 degrees removed from accessing substances. And we need to understand that that's just a reality. It's part of their experience. So again, having those conversations, being involved in your child's life, there are certain protective factors for addiction, and there are certain risk factors. One of the biggest protective factors, is delaying onset of first use. Do not use substances until you are older. But one of the biggest protective factors is parental involvement and, asking questions, open-ended questions. How was your day? Who are your friends? What did you do today? How's your homework load? And believe me, again, I'll say it again, I've had plenty of doors closed in my face. I want my privacy, don't talk to me, but they're still hearing us. They're still connecting with us. And I think that that's really critical to understand.
So the chat is blowing up with questions about marijuana. So I'm going to respect that. And I'm going to create an amalgam of 3 of the questions that were really excellent questions that were asked. So number 1 is, can marijuana be helpful for the treatment of any sort of mental health problem like depression or anxiety, and how to talk to a person who believes that they're using it for that purpose and feels truly that it's helpful for them for that purpose. How, kind of taking it beyond that, how to practically, what are some practical ways for a parent to help a child who is battling with marijuana use? Dr. Berman.
So first thing I would say is that before we spoke about, or I mentioned the concept of someone having a disorder, for example, depression or anxiety, that is caused by a substance. The flip side of that is what we call self-medication. And as we all know, starting with alcohol, alcohol is known as a social lubricant. Why? Because people who often have anxiety don't seek medical help for their anxiety, but they find that if they have a drink, they're able to lower their levels of anxiety and go on and function seemingly at the beginning better in life, but then they find out that the substance itself, the substance use takes on a life of its own. And that's true of other substances such as marijuana. Marijuana has a place in the treatment of certain disorders, severe pain, what we call wasting illnesses, people who have chronic viral illnesses such as HIV. There is a limited role for marijuana in treatment of those illnesses, and it's available as a prescribed medication. But the notion has come about now that I can treat any problem I have if I just if I smoke weed. In fact, it's a big injustice, I think, to the community as a whole, and I mean the greater community in the United States, to have dispensaries, because it's very easy to get a prescription for marijuana nowadays. The doctor who writes it, and no one really audits records or anything, just has to write, this person is being treated for anxiety, they're being treated for a particular disorder. This is not mainstream treatment in the medical community today for anxiety or any other related disorder. And it's problematic, and people will fall back on that as an excuse to keep on using despite the consequences that it has. And again, the marijuana that's being sold in dispensaries is as or more dangerous than that which people are getting off the street. I'm not minimizing what they buy from their friends or colleagues, but it can be even more devastating. It's not how we treat illnesses. If someone is anxious before an exam or they have a chronic problem with anxiety, we don't say, well, just have a few drinks and you're going to be okay. We know that's not responsible. That's not responsible behavior. There's one thing I wanted to interject because I didn't know exactly where we would put it. And that is, when someone takes a substance initially or after a couple of uses, we don't know what their genetic preloading is. Are they predisposed to a substance use disorder? And nobody really knows that when they start out. And that's why there's been such strict labeling and enforcement of the use of opioids, because we don't know who it is that is likely to become dependent on the medications.
So let's move on to talk a little bit about some signs that a parent can look for that would alert them to concerns about their child's use of substances. Rabbi Gluck, why don't you take this?
I'll jump in for a second, just before we talk about the signs. Also understand, because I just saw this question, I think it's very important. I'm sorry, I just realized that I see the questions as well about the vulnerabilities. What Dr. Berman said, I can't stress that enough. Too many teenagers firmly believe that if they smoke some weed, it'll help them stay calm. They're having issues at home, whether it's parents, peers, bullying, peer-to-peer, fighting. It doesn't really matter. And they truly feel that this will help them. The mere fact that it has been so acceptable, I mean, right now, I think the last study that I looked at was like more than 30% of 8th graders are using marijuana, I'm not going to say regularly, but like more than twice a month. I mean, that's that's a large number. So we talk about, things of that nature. We have to also understand that for some reason, and, I just read a study about poverty, that people that live in very, very poor countries, they don't view themselves as poor, and they have much less stress, anxiety, and much less, substance use disorder. Versus those that are living in more affluent communities where they have everything they want, but nothing is ever enough. We're living in a time right now that, our children just feel that things aren't enough. They're always anxious. Things are a lot of pressured, and they're looking for ways to deal with that. So that's something that I think is really, really important. As far as the signs, again, I have to say this. Unfortunately, we could speak about all the signs in the world, and I'm going to mention some, but that does not mean that they are always going to be there. We have way too many situations where people are like completely blown out of left field saying, I can't believe this happened. I never saw this coming. And that's true. So why do I preface with that? Because it's very important for people watching not to assume that signs are the only way to tell. They're definitely an indicator. We have to keep them in mind, but that doesn't mean that that is the only way. And there are so many. I'll just mention a few. I'm sure that everyone else will have plenty to add. Change of behavior patterns, someone that normally has a certain enjoyment of one thing and all of a sudden switches to another. Change of groups of friends. That's usually a very, clear indication, or if somebody has X amount of friends, for all these years and all of a sudden switches to another group. Change in grades in school. And by the way, it's interesting for people to know this, both directions. Okay, if somebody is doing great and all of a sudden starts dropping in grades, or if somebody's trying to compensate and they were like a B, C student and all of a sudden they're getting straight A's. Most people will be like, wow, that student's doing so great. Again, it is still, if it's done rapidly, it's an unhealthy behavior pattern change. So you have to look at that as well. Sleeping habits. Again, this is something that some people might say, well, all teenagers like to sleep a lot. Might be. I mean, I have few of them right now, and that is definitely true. But people that are using substances like to sleep more, or they're tired more, or they're out partying late at night so they can't get up in the morning. So these are just some of them. I mean, bloody eyes, look if they have a lot of Visine around the house all of a sudden that, they weren't using regularly. Also, paraphernalia. There's a lot of, whether it's pipes, bongs, rolling paper, if they're starting to have powdery substances, around the bathroom, just look for things of that nature. And also very important, I should have mentioned this earlier, is, very often we as adults, or even not as adults, will get prescribed medications. We don't use them all. We'll just put them someplace, not realizing how dangerous that is. So we need to also make sure that whenever we do have prescribed medications, they are not in a place where other people in the house can have access to it, and that they are safely disposed of when they're no longer needed.
Thank you. Thank you. Excellent. So another question has come up in the chat about denial and how to most constructively manage denial in a parent or a child or a loved one. How about Ms. Forman? Why don't you take this away?
Sure. I was actually going to say Dr. Berman should take this.
Oh, okay.
That's my answer, Dr. Berman.
Okay, so denial, as I say, denial is not a river in Egypt. Denial, most medical, let's format it this way. When people have signs or symptoms of other illnesses, we usually know what they mean. So if someone comes to us and says, makes this hand motion, it means usually they can't breathe or that they're choking. And if someone has their hands across their chest, it means they're having chest pain. The problem with substance use disorders, I think universally, is that denial is the presenting symptom. I'm okay, nothing's wrong, leave me alone. I think the way to overcome denial is for all of us to become more educated, parents to become educated, and always have the possibility in mind that their child may be having a problem with substance use, because it is common in this age group. This is when the kids are experimenting. But the thing to avoid, and I'll put this up front, is don't be accusatory, because the moment you become accusatory, they'll push back even further, and you're very unlikely to get to the truth, or to get to the truth in a meaningful way. You're more likely to, blow away a relationship. So I think it's to recognize that denial is a problem, and to use, as someone mentioned before, open-ended questions. What's going on? How are you doing? I've noticed this. Can you tell me a little bit more about why you're having, difficulties in school all of a sudden? The other part of denial, though, that has to be overcome, and I think that we're here for tonight, is to get parents educated about the fact that even their kids, the best kids in the best schools, in the highest tracks, and with the most to lose, are often the ones who are getting involved with substances. And we have to have a steady state of awareness. I think Lianne mentioned, did you not mention situational awareness? It's being aware of what's going on around you. I think parents need to be aware of everything that's going on. And the other thing is to encourage people in terms of denial is to speak to people who are knowledgeable, speak to people from CCSA, speak to community members who know about the about the issue and try to get some help in terms of figuring out what's going on. But the one thing not to do is to go in there with guns blaring and, you, because you're going to get no, very quickly.
Right. And I think it's really, we also talk about this in our parenting program, asking those questions in a way that, I'm concerned about you, like not you're acting strange, you're behaving weirdly. I'm concerned. And just, something that Dr. Berman said, Ilana, was a model student in her high school. I mean, 4.0 average, got into an honors program, captain of her soccer team, founder of her chess team, social, had lots of friends, composed music, really multi-talented, very, very bright. So you just can't ever look at your child and go, oh, no, not my kid. And one thing we do talk about, and we try to equip kids with the language, is using drugs doesn't make you a bad person. It's not a moral failing. It's not a character flaw, but it's a dangerous behavior. And so when we talk to children, when we talk to parents, we say, we try to help them find the language to speak up, to get the help that they need, to remove the stigma associated with it, to understand it is a mental health condition. In many cases, it's not that a kid went out and partied and took drugs, although that could be that they're experimenting, they're curious, and unfortunately they're one of the people that's wired that way. But in a lot of cases, we talked about before, self-medication, that they think that if they drink or if they use weed. I've had kids come up to me and say, I can't go to any social situation unless I get high. I have to get high. Or I had one kid tell me that her friend is using and her friend wants her to use and she doesn't really want to, but her friends keeps on saying, I know how to do it safely. I'll take care of you. So there's that pressure that, our kids are dealing with so many conflicting emotions. Like we said before, they're separating from us. They're forming their own identities. So one thing to really remember, and this helps us to destigmatize it, is again, using substances doesn't make your kid a bad kid. It doesn't make your loved one, forget your kids. There are plenty of people in my support group who are there for their spouses. It doesn't make your adult child or spouse or cousin or uncle bad, but they're struggling with something that unfortunately is like any other mental health condition. There needs to be awareness, there needs to be acceptance, compassion, and there is treatment.
Thank you. No, that's such an important point. I want to shift a little bit to talk more about prevention and thinking about kind of how we can sort of anticipate some vulnerabilities that our children might have that might make them more prone to use substances, and how we can help them, work around that and focus on, what are the strengths that we can help them focus on to try to prevent that. Rabbi Gluck.
Okay, so again, going back to something I mentioned earlier, what we have noticed, and again, we've piloted our project for about 2 years, and now we're in about 65 schools throughout the country, is really just building up resilience and emotional healthiness of our children. That's really what it boils down to. Years ago, people would say to me like, oh, somebody became an addict because of A, B, C, and D. And while it may or may have not been true, still up for debate. Today, it's certainly not true. And at the same time, I don't think 15 years ago, I would have commonly seen 13 and 14-year-olds using heroin, opioids, things of that nature on a regular basis. Now it's much more common as well. I think the real key is, and I say this from our perspective, spending time with kids. Just go back to the basics. Having dinner with your kids, not having your phone at the table with you so you can actually talk to them, communicate with them. Let your children know that they matter and they can come talk to you. Because if you're too busy for them, they're going to find something else that will not be too busy for them. And that something else can be a substance that can be very dangerous for them. At the same time, having these dinners or playing board games or whatever it might be with your children also gives them the ability to open up in a more relaxed setting, where every conversation one is having with their kids after school is not always, did you do your homework? What'd you do today? Did you prepare for a test? It's not always coming in a pressured manner, but something where, hey, we're also communicating. As far as, the vulnerabilities, I mean, listen, we're living in crazy times. It is what it is. People talk about addictions. I mean, the studies clearly show, and if you do your own survey, you'll ask people that don't wear their phone on Shabbos, how many times did you feel your phone vibrate, even though you don't have it with you? And many people will say, oh yeah, I felt it, and it's ghost vibrations. We're so, pardon my language, addicted to our technology, to our phones. I think they said like the brain reacts like 6 times more to each time you look at a smartphone screen than other things. And we've created, we call them smartphones. The joke is that making our society dumb. I don't remember phone numbers like I used to. Why should I? People aren't thinking through anything. Anyone has a question, there's no more learning. It's let me Google something. So we're taking away a lot of that, I guess where people would grow up. I mean, I saw the greatest meme was, they had like a bunch of bicycles, lined up in front of somebody's house. And it's like, I didn't know where my friends were, but I didn't have to look for likes. I had to look for bikes. And we look at what's going on with social media now, and that's become the new world where if you have more likes, you're more popular, even though it's completely fake. But that's because there's less interaction that people are having, with each other and with friends. And that is something that is extremely important. So I think that what we really need to do is we really need to give children things to do. We need to make, and this is regardless of age. I mean, what was that line, Lianne? Last time it said the opposite of addiction is connection, right? Wasn't that the line that was used? To keep people from being addicted to things, you want to connect with them. I think right now, the connection that a lot of our youth are having are a false sense of security, whether it's social media, whether it's online gaming, whether it's living for what other people will see about them because people are not feeling good about themselves. And that's just the reality of the times we're in. And yes, it is very tough and it's a day late and $1 short, but it doesn't mean it's too late because it's never too late to be able to spend time with our kids, make sure we have open lines of communication, healthy relationships, be there for them. And like Dr. Berman said, and we've said this many times, kids will do things. It's a little bit of an issue. You don't attack them because at the end of the day, you're shutting them down and they're not going to want to communicate.
Thank you so much. Now, this is actually a great tie-in to two recent webinars that we did on resilience with amazing panelists that are clearly relevant to this topic. Thank you for bringing that in. It's posted on our JOWMA YouTube channel, as this webinar will be. So please subscribe. Let's talk about conversations between parents and children about substance abuse, and what age do you think it's appropriate to initiate a conversation like that, Ms. Forman?
I think every stage and age is going to have a different answer. And there are, I wouldn't ask my second grader, do you know who to ask if you want drugs? But I did that to my high schoolers. So, and that really was just to kind of assess the reality, what is their surroundings? What are they dealing with? I think that if it comes up organically, you're drinking a glass of wine or the 4 cups of wine at the Seder, and your kid asks you, what is that? Can I have that? Why am I having grape juice? First of all, when your kid says to you, can I have that? You could, instead of saying yes or no, why do you want that? What are you? And then you can really start to probe, what is the reason you're asking me why you want that? You can find out if it's because they're looking at something that, somehow you've inadvertently glorified. And I don't mean glorify like, ooh, ah, but just, they see a behavior and they think, oh, this is a grown-up behavior. Mommy and daddy do this. I want to do this. I want to act grown up. Or are they thinking it's something special? You only get it on special occasions. It's like a piece of candy or a lollipop that the, candy man hands out in shul. So there are different ways that kids are picking up on substance and substance use, which you can probe, you can ask. And again, it's meeting them where they are. So when they're younger, taking an opportunity, a teachable moment. Don't ignore the smell of weed that is all over the city right now. I mean, and the marijuana trucks that are everywhere. Don't ignore them. You can use that as, do you smell that smell? What does that smell like to you? To some people, it smells like skunk. To some people, it has like a sweet smell, again, maybe an older kid, maybe not a second grader. Our education that we talk about starts in 6th grade. I think all prevention experts talk about prevention education, ideally starting as early as 5th grade, formally. Informally, it can start anytime, and I don't think it's anytime is too young. I think kids, again, are being exposed on so many different levels in so many different ways. And it doesn't have to be social media, and it doesn't have to be movies, and it doesn't have to be TV. It is literally walking the streets and seeing smoke shops. In our town, we've had 6 smoke shops open in the last few months, and there's CBD products everywhere. And again, they're being bombarded from all sides, whether it's the news, whether it's discussion, whether it's just seeing it in action. So I think it's important, again, to have those conversations early, often, organically, take those moments, teachable moments, and engage them on whatever level you think is appropriate. And don't be afraid. Don't be afraid. They're seeing it and hearing it, believe me. We have now collected thousands of questions from kids ages 6th grade and through 12th grade. They know what's going on, and they're asking those questions. And it's better that you as the parent are answering them than they're getting their answers somewhere else or nowhere.
Thank you. Thank you. Let's just talk for a couple of minutes before we conclude about nicotine. What's the best way to talk to our children about nicotine? It's kind of less of a marijuana is a more popular topic, but I don't want to miss nicotine. Dr. Berman. You're muted, Dr. Berman.
Up until recently, I think it was probably the substance that most people would have been preoccupied with. But the point is that nicotine, again, it's how we approach things with our kids that are potentially dangerous and can cause harm. And I don't know of any redeeming benefits for smoking. Kids use it for a variety of reasons. I don't think many of them start out really enjoying it. I think nicotine has a unique place in among substance use disorders. It's often actually the first substance that kids experiment with. And if they continue to use it, they see that it has a social benefit to it. They might find their chevra. And when you say you see kids changing their groups of friends, this is one of the things that you can often see. But I think we have to be frank with kids. I would hope that the schools are doing a good enough job in terms of educating kids about smoking. There's really nothing good that it does for anyone, and it does cause harm to the body. And it sets the brain up, I think, for looking for that quick reward, for that quick dopamine release. And nicotine is a very potent drug. And if you get someone now, as I often see, who's in their 30s or 40s and say, oh, my primary care doctor says I have to quit and I want to, but it's so hard. I think we have to educate kids that this is a dangerous substance, and that the sooner if you avoid it, you've what we call dodged a bullet. It's something you don't want to get involved with. I think, thankfully, in our community, I'm talking about here in Teaneck and in New Jersey, there aren't that many people who actually smoke. I think the stigma has worked against the use of nicotine, and there are very few people, in fact, who smoke. But we have to push back against it because of the harm that it causes. And we shouldn't, we don't want to scare kids, and we don't want to come off as looking ignorant and say, well, if you smoke once, you're going to have a heart attack. Probably not true. Again, as with anything else, we have to be educated, and we have to educate our kids in a calm and sedate fashion for them to accept what we're saying. Most importantly, if we don't smoke, we're less likely to have kids who do smoke.
Yeah, I just wanted to say that I had a New Jersey school contact me for programming in middle school. And they said, can you focus on vaping? Because our kids are vaping, 7th and 8th graders are vaping, and they make fun of the kids that don't vape. They ostracize them. And I know of other schools in Brooklyn where, we've talked to schools, and in those schools, the high schoolers, boys mostly, are smoking actual cigarettes. So we talk to the kids on various levels. The first level is, number one, nicotine happens to be one of the highest addictive substances out there. you know, so you think it's not dangerous, you think it's not, you know, not a big deal, but it really is. And we've had kids in high school begging us to help them get off nicotine, get off vaping. They don't realize that most e-cigarettes that are out there contain traces of nicotine, regardless of what the packaging says. You know, we always say a Juul pod contains as much nicotine as 20 cigarettes, as a pack of cigarettes, and they're always shocked about that. And we talk about the fact that it turns them into dual users. Typically, you know, you're 4 times more likely to end up using traditional cigarettes, which you all knew was bad. You're all educated. We have them raise their hands. How many, you know, people think cigarettes are bad, traditional cigarettes are bad, and they all know it causes cancer. But then we talk to them about the increased risk that they're going to end up, and we show them ads. We show them ads from, you know, years ago where cocaine tooth drops and amphetamines for dieting, and doctors sitting there with Camel cigarettes saying, this is my favorite brand, you know, are being advertised. And we say, what do you think of those? And then we show them current ads, marijuana, you know, White Claw, spiked drinks, Juul, Miley. And we say, what do you think? And what, you know, just like you look at these from 50 years ago, what do you think people 50 years from now are going to think about these ads? And when we have the science and the data, and we know that these things are terrible for us, what do you think they're going to think about us, that we were using these and that we were the guinea pigs for these advertising companies? So we play on a lot of different angles to hopefully prevent usage, but that's a big thing to talk about. And we shouldn't lose sight of that.
So some amazing questions just came up in the chat. Unfortunately, we're really running out of time. I'm hoping, Dr. Berman, you can just spend 2 minutes on addressing the connection between ADHD and substance use. I know there's kind of concerns about that going in both directions.
So ADHD, or attention deficit hyperactivity disorder, and various manifestations, is it's a mental health problem that's seen, usually manifesting in younger people, the age groups that we were just talking about, 6th grade, 7th grade, and up. People who have ADHD are often very uncomfortable in their own minds, and they're looking for some type of relief. If someone suspects that their child does have ADHD, which can interfere with socialization, it can interfere with academics, it can interfere with a whole host of variables, even getting along with the family, it has to be addressed. It should be addressed. And that means addressing it through a competent mental health professional. It could be the proper therapist, you know, someone along the lines of, you know, a Dr. Ackerman. It could be through a psychiatrist, a child and adolescent psychiatrist. It should not be ignored, because kids who have ADHD are more prone to experiment and try substances in order to self-medicate for the situation, you know, for the situation that they're dealing with. They don't even think it through. They just know that they need relief, and anything that's offered to them is often seen as a way out for them to feel better. So if someone does have ADHD, it should be assessed by someone competent, and when necessary, treated both behaviorally and if indicated with the proper medications. But left untreated, ADHD takes on a life of its own and progresses into other mental health issues. And I think some of us have heard of, you know, oppositional defiance behavior. It's disorder. It's something that has to be addressed. We can't just ignore it and say they'll grow out of it. Some kids do grow out of it, but there's a price for growing out of it.
Thank you so much. Okay, before we sum up and thank all of our excellent panelists for this amazing event, I want to briefly introduce Dr. Debbie Ackerman, LCSW, who is a group facilitator and community program advocate at MASC, who is here to tell us about her amazing organization and the resources that it offers.
Okay, thank you very much. Good evening to everybody. First of all, thank you all for an incredible presentation and all the great work that everybody is doing with this really very difficult problem. Dr. Berman, I'm an addiction specialist, not an ADHD specialist. I don't want to get calls for what I don't do, but thank you for the plug. Also very important. So I'm a group facilitator and do a lot of community education for MASC. MASK is an absolutely wonderful organization that was founded by Ruchama Bistritsky-Klapman. She founded about 25 years ago and thus far has serviced about 117,000 families. So Ruchama is a very busy woman who does incredible work. It's a referral organization for all mental health and addictions, therapists, inpatient programs, outpatient programs, and it is worldwide. The referral network is worldwide. We run parent support groups, both in person, and we're still doing it via Zoom. There's an after-school program, and there are community programs that are constantly working to combat the stigma and the shame that follows both addiction disorders and mental health disorders. Additionally, there's also a radio show on Thursday nights with Zev Brenner on 6:20 a.m. talklinecommunications.org. All previous shows are on the website, which is maskparents.org. There has also been now naloxone training, free training, and they can be trained by Zoom, and then it can be mailed to you. If you'd like to contact MASK, they are open from 10 a.m. to 10 p.m. The hotline is open from 10 a.m. to 10 p.m. The number is 718-758-0400. 718-758-0400. 117,000 people. I guess that's fortunate or unfortunate. Unfortunate that many people in our community need it. Fortunate that we have wonderful organizations that were represented here tonight and MASK. So thank you all for your time and continued success to everybody.
Thank you so much, Dr. Ackerman.
Pleasure.
Okay, so before we wrap up, do any of our panelists have any concluding remarks, anything to say in conclusion?
Just want to say thank you. It was a pleasure to be here. And if anybody wants, I'm going to offer Lianne first. Lianne Forman or Dr. Berman or myself at any point to do any sort of awareness events or anything in their communities, please feel free to reach out. And I will leave with the following. Those that have children in schools, please speak to your kids' schools and encourage them to create better programming, prevention, and education for all of these issues, as well as many more. Thank you very, very much for having us here, and it was an honor, and hopefully we will have brought some light and helped some people here tonight, even one.
Thank you so much, everybody. Really, this was like an incredible conversation focusing on like honesty and transparency around an issue that's so stigmatized, especially in the Orthodox community. So this was just such an important conversation for us to have. It was an evidence-based conversation, and it was a conversation that really focused a lot on prevention, which is really the beginning. An ounce of prevention is worth a pound of cure, right? So thank you all so very much. I just want to remind everybody to please complete the post survey. We'd be so grateful to you if you would do that. It really helps us with our programming. And you can be entered into a chance to win a $100 Amazon gift card. The QR code has very helpfully just been put up on your screen. So thank you. Please fill out our survey. Next week, we will be having another webinar for parents and for teens. The link to register is in the chat. Thank you so all very much for joining us. And please stay tuned. This webinar will be posted on our YouTube channel, so please subscribe. Thank you. Have a good night, everybody.
Thank you so much.